Welcome back to Studio 512. Today we're joined by Dr. Bridget Brady and Dr. John Sabra from Austin Thyroid Surgeons. Welcome to the show to both of you. Now, right off the bat, I want to talk about thyroids and what they are because we hear it a lot, but some people just have no clue what the thyroid does.
Well, good morning. The thyroid actually is a butterfly-shaped gland. It lays on the front of the neck and it maintains our metabolism. So it's very important. It affects all organs in our body. So it's very essential for your overall health and well-being.
Okay, now tell us a little bit about your practice and what you guys do at Austin Thyroid Surgeons.
Well, what we focus on, thyroid cancer is the fastest growing cancer in the United States and around the world today. So we felt there was a need for a focused surgical practice here in Central Texas to give better care to these patients with thyroid cancer and parathyroid disease. So it's our belief that having two expert surgeons seeing and evaluating every patient improves not only their patients' outcomes with this team approach, but also their overall experience.
Okay, great. Now, Dr. Sabra, can you tell us a little bit about when thyroid surgery is actually needed?
Of course. Well, actually, we try to avoid surgery if at all possible, which sounds a bit funny coming from surgeons, and we hear that a bit, but we know it's the right thing for our patients to do as little as possible, and we believe in what we call natural thyroid surgery, leaving as much as possible. So surgery is necessary in the vast majority of patients with thyroid cancer, and even with benign nodules that aren't cancer, sometimes they get big enough where they put pressure on other organs in the neck, other structures in the neck, and those may need surgery as well. And we have tools to help us decide who needs surgery and who may not. We actually, at our practice, use genetic testing or gene testing. We actually test the genes in the nodules, and that can help us avoid surgery in many cases, and in others, do less surgery, do partial thyroid surgery.
Okay, excellent. Now, Dr. Brady, can you tell us a little bit more about what makes your practice so unique?
I think our practice is unique because, as Dr. Sabra was saying, we focus on trying to preserve as much natural thyroid gland as possible, even in cases of thyroid cancer. So I think in that way it's unique. We also do minimally invasive surgery, which creates less pain for the patients. A lot of our patients have minimal scarring, so their cosmetic outcome is ideal. And since they are having less pain and doing well, a lot of them go home the same day as the operation.
Fantastic. Now, real quick before we go, do you have any tips or pointers on what people should be looking for when they're checking for their thyroid?
Absolutely. Look for any unusual lumps or bumps in your neck, and if you have any concerns, go see your primary care doc or your OBGYN, have them check you. You can get a wellness screening with an ultrasound is the other tool that can be used to look for nodules. Just keep an eye out for anything that feels unusual in your neck.
Okay, Dr. Sabra, thank you so much. Dr. Brady, thank you very much.
Thank you.
All right, Austin Thyroid Surgeons has locations in North and South Austin and in Kyle. To schedule an appointment, call 512-887-3187 or go to austinthyroidsurgeons.com for more details.